It's American Heart Month, and in today's Your Healthy Family, I'm taking a deeper look at a heart condition that impacts 40% of people over the age of 65, chronic total occlusion, or CTO. What is it? What causes it? And how do doctors with NCH healthcare system treat it?
CTO stands for chronic total occlusions, which are coronary arteries that are blocked and have been blocked for quite some time.
At least 3 months, to be exact. NCH interventional cardiologist Dr. Adam Frank says it happens when a coronary artery, which supplies blood to your heart, becomes almost completely blocked with plaque.
The plaque or the obstruction becomes calcified, very challenging to push through, and the longer it's there, the much harder it is to get through.
That plaque is caused by high cholesterol, diabetes, being overweight, inactive, and eating a poor diet, and it can lead to heart disease.
Most people that have heart disease, they typically think they need to have chest pain, tightness, pressure.
And that can be the case.
But CTOs, because by definition they've been there for a while, a lot of those classic symptoms of discomfort aren't always the predominant symptom. So shortness of breath is a very, very commonly described symptom. Fatigue, exercise intolerance.
Dr. Frank says many times people can have this kind of blockage in their coronary artery for years without even knowing.
Because the symptoms could potentially be so sort of generic, fatigue, shortness of breath, people may attribute that to getting older or slowing down. They don't realize it until they are, evaluated. They may come to the cath lab, have an angiogram, and then they're diagnosed with having a chronic occlusion.
And he says doctors find a CTO about 1/3 of the time they do a heart exam, using an X-ray imaging or through a catheter.
And it's one of the leading causes for people to be referred for coronary bypass surgery.
But that's not the only treatment option available. Dr. Frank says NCH healthcare system was the first in Naples to offer another treatment that's much less invasive. It's all done through a small incision on your wrist or groin. I'll explain in tomorrow's Your Healthy Family. For Your Healthy Family, I'm Lisa Greenberg.